If you have neck pain that shoots down your arm, the pain you feel is a symptom, not the real problem. In most cases, the shooting pain is coming from a pinched nerve in the neck, also called cervical radiculopathy, and many people are never told by their doctor what is actually causing their arm pain. In this video, I'll explain the 5 most common reasons nerves get pinched in the neck and how each one creates pain that travels down into the arm. And make sure you stay until the end, because I'll show you one of the most effective ways to treat a pinched nerve in the neck without surgery, injections, or relying on anti-inflammatories. We've used this approach to help thousands of patients get rid of arm pain that kept coming back. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I help people get relief from disc bulges, sciatica, pinched nerves, and chronic spinal issues without surgery or medication using chiropractic corrective care. Subscribe now if you want simple exercises and proven tips to help you feel better, move better, and stay pain-free. Before we talk about the 5 most common causes of a pinched nerve in the neck, it's important to understand why the symptoms show up in your arm in the first place. Even though the pain is felt in the shoulder, the arm, or your hand, the source of the problem is usually the neck. Your neck is made up of 7 vertebrae that form the cervical spine. Inside the spine is the spinal cord, and branching off from that are the spinal nerves. The spinal nerves that come from the lower part of the neck, typically C5 to T1, join together to form the brachial plexus. These nerves travel down the neck, down the arm, forearm, all the way into the fingers. When one of these nerves gets irritated or compressed in the neck, the pain doesn't just stay locally. Instead, the pain travels along the nerve's path, which is why it can feel sharp, burning, tingling, or electric as it shoots down the arm. So even though your symptoms are in your arm, the real issue is often higher up in the neck, right where the nerve exits the spine. Now, let's go through the most common reasons those nerves get pinched in the first place. One of the most common causes of a pinched nerve in the neck is simple wear and tear over time. This is often referred to as degenerative disc disease or spinal arthritis. With degenerative disc disease, the disc between the vertebrae can lose its height and hydration, which reduces the space available for the spinal nerves. At the same time, the spine may form bone spurs in response to joint stress, abnormal spinal alignment, poor posture, or instability. These changes can narrow the openings where the nerves exit the spine. This opening is called a foramen, and we'll talk more about that later. When the space surrounding a spinal nerve becomes reduced, even normal movements like turning your head or looking down can irritate the nerve. That irritation doesn't always just stay in the neck. Instead, it often travels down the arm along the nerve's pathway, creating pain, tingling, or numbness. This is why arm pain can slowly appear without a clear injury. The changes happen gradually, but once the nerve becomes irritated, symptoms can feel sudden and intense. Another common cause of a pinched nerve in the neck is a herniated disc. Each disc sits between 2 vertebrae and acts like a shock absorber. Inside the disc is a softer gel-like center surrounded by a tougher outer layer. When the outer layer weakens or develops a tear, the inner portion can move outward and place pressure on the nearby nerves. When this happens in the cervical spine, the nerve irritation often creates pain that radiates out of the neck down into the shoulder, arm, and hand. Some people may often notice tingling, numbness, or weakness in the arm or hand. A disc herniation can develop suddenly from an injury, like a sudden trauma or an accident, but can also occur gradually as the disc weakens over time. In either case, once the disc presses on the neck, everyday movements of the neck can repeatedly aggravate the symptoms, making arm pain persistent or unpredictable. Another common cause of a pinched nerve in the neck is called neuroforaminal stenosis. If you had an MRI, you may have seen terms like neuroforaminal narrowing or encroachment in the report. This refers to a narrowing of the small openings on each side of the spine where the nerves exit. As mentioned earlier, these openings are called the neural foramina. When the space inside the foramina becomes reduced, the spinal nerve can become compressed or irritated. That irritation doesn't just stay in the neck. Instead, it often causes shooting pain, tingling, numbness, or weakness that travels down the arm. Neuroforaminal stenosis is most commonly caused by degenerative disc disease and spinal arthritis. As discs lose height and arthritis develops, bone spurs can form. These bony changes can crowd the foramen, reducing space for the nerve and triggering arm pain with normal neck movements. Neuroforaminal stenosis can also be caused by a disc bulge or herniation in the neck. Another cause of a pinched nerve in the neck is injury, especially whiplash or severe trauma. This can happen during a car accident, a fall, sports injury, or any event where the head or neck are forced to move suddenly beyond the normal range. When this type of injury occurs, it can strain the joints, discs, and ligaments of the cervical spine. The inflammation or structural damage that follows can reduce space around a spinal nerve or cause the surrounding tissues to swell. In some cases, the injury can contribute to a disc bulge or herniation, further irritating the nerve. When a nerve root becomes irritated after an injury, symptoms often extend beyond the neck. Pain can shoot down into the shoulder or arm, sometimes accompanied by tingling, numbness, or weakness. These symptoms may appear immediately or develop days or even weeks after the injury. The final cause of a pinched nerve in the neck is poor posture or repetitive neck stress. Spending long periods looking down at phones, laptops, or tablets places the cervical spine in a sustained forward position. Over time, this increases stress on the disc, joints, and surrounding tissues of the neck. This constant strain can contribute to disc bulging, joint irritation, and reduced space around the spinal nerves. Even without a single injury, these repetitive stresses can gradually irritate a nerve root and lead to pain that radiates from the neck into the shoulder, arm, or hand. The important thing to understand is that while these 5 common causes of a pinched nerve may look different on imaging, they often create the same problem: pressure and irritation on the spinal nerve. Now, let's shift focus to what you can do about it: how to treat a pinched nerve in the neck and relieve shooting arm pain without surgery, injections, or medication. One of the most effective ways to directly treat a pinched nerve in the neck is with non-surgical spinal decompression. We've used this approach with hundreds of patients and have seen strong, consistent results, not only in reducing shooting arm pain, but also in helping people decrease their reliance on medications, avoid injections or surgery, and return to normal daily activities without nerve symptoms controlling their life. So what exactly is non-surgical cervical decompression? Spinal decompression works by gently stretching the cervical spine in a very controlled and precise way. The goal is to increase space between the vertebrae, reduce pressure inside the disc, and take stress off the irritated spinal nerves. When a disc bulges or herniates, the outer layer of a disc can press directly against a sensitive nerve root that travels from the neck into the shoulder, arm, hand, and fingers. Cervical decompression creates a small amount of negative pressure inside the disc, similar to a vacuum effect. This helps encourage disc material to move back towards its normal position, reducing pressure on the nerve and allowing it to calm down. It's important to understand that spinal decompression isn't only helpful for disc herniations. It can be effective for all causes of nerve compression in the neck, including degenerative disc disease, spinal arthritis, bone spurs, and neuroforaminal stenosis, all of which can create the same shooting pain known as cervical radiculopathy. In our clinic, this is performed using a specialized spinal decompression equipment called the back-on-track, with an add-on cervical decompression unit known as the Cervineck traction unit. You sit or lie back comfortably while the machine gently moves your neck through a slow, rhythmic decompression cycles. There are no sudden movements, no twisting or forceful pulling. Most patients describe it as a deep, gentle stretch that relieves pressure rather than causing discomfort. This treatment helps restore spacing between the vertebrae, reduces pressure on the pinched nerve, and improves the disc ability to receive oxygen and nutrients needed for healing. When combined with chiropractic care, cervical decompression focuses on fixing the root cause of the problem instead of just masking the symptoms. Now you understand the 5 most common causes of the pinched nerve in the neck that can create shooting pain into the arm. More importantly, you've learned about non-surgical spinal decompression and how it can be applied to the neck to reduce pressure on the nerve, restore proper spacing, and support long-term healing. If you're dealing with a pinched nerve in the neck that's caused shooting arm pain, it's important to know that this usually does not resolve on its own. And even if symptoms temporarily improve, that doesn't mean the underlying cause was corrected. Without addressing the root cause, the pain can always come back. That's why I recommend being evaluated by a doctor or a therapist who treats cervical radiculopathy and uses cervical decompression like I described in this video. If you found value in this video, like and share it so others dealing with neck and arm pain can find this information too. And if you have questions about a pinched nerve in the neck, drop them in the comments below. I read and respond to every question. And subscribe now if you want simple exercises and proven tips to help you feel better, move better, and stay pain-free. And if you want relief exercises from a pinched nerve in the neck, watch this video next, where I show 5 easy and safe stretches and exercises to relieve arm pain caused by a pinched nerve in the neck.